Hello everyone, welcome to SCubeTV Global. I am your host Rajni Bharara. Today on the show, I have with me again a very special doctor, a very special guest who have been on our show a couple of times, and he's again here to discuss with us a very, very important topic. His name is Dr. Syed Nusrath, and he is a cancer surgeon. Today on the show, we are going to speak with him about diabetic foot and all the questions related about the disease and about the problem. But before, let's welcome him to SCube TV Global once again. Hello, Dr. Syed. Welcome to SCube TV Global once again.
Hi, Rajni. How are you doing? Thank you very much for inviting me again.
Thank you so much. So, Dr. Syed, now I would like to, come to the topic, and I would like to, like I've mentioned in the beginning, that we are going to speak with you about diabetic foot today. So, firstly, before I ask you any other question, I would like to know from you what exactly is diabetic foot. If you can please talk about that and explain that to our audience.
Diabetic foot is a person who is diabetic and who does not care for his leg. He does not take care properly. So that is the most important cause for infection in the foot, because foot is the place where you walk barefooted and sometimes you tend to hit a stone or a thorn prick. So that is where you get an ulcer, a small thing, or a swelling in the foot. So that is the name we have given for diabetic foot. Most commonly now 64 million people over the global are suffering with diabetes. Out of this, 30 to 40,000 together, they will be suffering from the diabetic in the form of an ulcer or in the form of an injury. So it starts with a small injury, then it goes to a bigger, where the patient will have to go for an amputation. The most important thing in the diabetic foot is you should take care of your foot like how you take care of your mouth.
Dr. Syed, also I would like to know from you. So, is it like that everyone who gets diabetes will get diabetic foot? Is it like that, or how is it?
Yeah, what happens is not everyone gets it. If you keep your foot clean and tidy, the chances of getting a diabetic ulcer or the diabetic foot is very, very rare. Probably 1 in 5 patients or 1 in 10 patients may get it, provided you don't keep your foot clean. That is number one. And then what happens in this diabetic foot is you lose the sensation. So that is known as the peripheral neuropathy. So you normally, it happens to runners or barefoot walkers who walk and then they have a thorn prick. So the nervous supply is cut off, peripheral neuropathy we call it. And then they don't know what is happening and the thorn pricks, and that is the nidus of infection and that is the focus of infection. So once a thorn pricks, it goes inside and then it causes infection. That is number one. Or some people will be having a callosity. So they take a scissor or they take a hygienic knife and then they cut it off. And that is the most common root cause. And third thing is the distance of the foot and the sole, the vascularity, that is the blood supply, is compromised. You don't have. So there is not enough of blood supply. So that is the most important cause for the organism to grow. The fourth cause is the nails. You don't cut the nails, and the nail cause injury when you're walking, when you hit it over a stone, or sometimes they walk over the hot object like a fire. So you don't have a sensation. The sensation is lost, peripheral neuropathy, you call it. And that is the time where you develop a diabetic ulcer.
Okay. So, Dr. Syed, also, how worse the diabetes has to get, or how worse the situation have to get that, the people might, the diabetic patient might develop a diabetic foot?
The first and foremost thing is you have to check your glucose level, which is normally 80 to 120 milligrams or 7.5, the latest HbA1c we call it. So what happened HbA1c. So this is the one where the scale you record your glucose level. Fasting is better. Then you call it the post-lunch. So this is the most important root cause. When you develop an injury and the sugar is high, then you start getting the infection over the foot. So you have to be very, very careful. A diabetic patient, you should control your sugar. Keep it 70 or 80 or even 90 is good. Fasting the sugar, even 100 is good. Control that sugar. Get a glucometer. Check your glucose level, which is of paramount important, because every alternate or the third person is going to be diabetes. Diabetes is not anymore a disease. So have to get your sugar level regularly if you have proved as a diabetic and an elderly person. Then you develop an injury, immediately take care of your foot, clean it, wash it, or you have a thorn prick, or you have a nail prick, or you have a stone injury, or sometimes you walk down and you burn your foot, or in the sunburn you walk with barefoot, burn it. There starts the problem of the diabetic ulcer, the diabetic foot.
Dr. Sayed, also, I would like to know from you that what are the common diabetic foot problems? If you can also please talk about that.
So once the patient develops an injury over the great toe, and the sensation is lost, and then a small ulcer forms, and then the ulcer becomes bigger in size. It goes into the muscle, underlying tissue, then it goes into the bone. And once it goes into the bone, you land up into problem. Bone will develop a condition called osteomyelitis. That is the infection of the bone sets in. So you should take care of it very nice. Whenever you have a small ulcer, smallest of the small ulcer, wash it nicely, clean it nicely, go to the doctor, clean it with spirit, clean it with hydrogen peroxide, clean it with betadine, apply some ointment, keep it dry sometime, and put some powder, then there you are. And the most important thing is the glycemic control. Control your sugar, control your ulcer. That is one of the important factors. Second thing, what happens is you wear some tight shoes. That is the most important thing. Whenever you don't keep your foot clean, you develop an ulcer, which is small, which is the great toe, or you get in the nails, which is known as the paronychia, where you get pus, and then it goes deeper in deeper size. So first and foremost, what you have to do is you have to cut your great toe or the little toe, whichever is involved. And once you cut that, then it becomes progressive. Most important thing is you should not wear. Diabetic people should care the foot very properly. They should not walk barefoot. This is the most important. They should not wear tight shoes, and then always their legs washed and then keep it dry using some powder or that, and maintain it to the level of paramount importance.
But doctor, when a patient is diabetic and the diabetes is not too much, but it's like also it's not too low, but it's on medication. The person is on medication. The patient is on medication. So, what are the symptoms of that patient who is diabetic that he's developing, that he might be developing a diabetic foot? So, what are the symptoms that we should be looking for?
First and foremost is the peripheral neuropathy. He will have nervous pain. He will not have any sensation. That is the first and foremost. Then there will be vasculopathy, where the patient will not have the blood supply probably. That is the second important part. Third thing is the patient will not be able to see. That is retinopathy we call. And the fourth one is diabetic nephropathy, where your kidney gets spoiled. So these are the most important causes. If the patient has got blurred of vision, the patient has got excessive passing of urine, and then he has a developed ulcer due to peripheral neuropathy and due to vascular incompetence, then you have to think that this patient is going to develop a diabetic ulcer of the.
What are some risk factors for the development of diabetic foot ulcer?
Yeah, the most important risk factor is the obesity in case of a diabetic foot ulcer. So the important thing is you should lose weight. Then you will have a bony pain, osteosarcopenia, where the muscle gets wasted. And what happens is the patient will have severe pain over the muscle. The muscle weakness will be there. Thin built muscle he will develop. That is the most important. And of course, about the diabetes in common, patient will have polyphagia, where he'll be eating a lot of, and polydipsia, where the patient will be drinking a lot of water, and polyuria, where the patient will be fasting. So these are the most important symptoms of the diabetes, which brings the patient to a diabetic status, and then this will become increases, and then it forms an ulcer. So once you develop an ulcer, for the ulcer in the leg, you may develop a cellulitis, where there is a swelling in the leg. So that is the most important cause, and underneath that cellulitis that may be pus. So the moment the patient develops these symptoms along with this pain and is not able to walk, then you can go for the symptoms that this patient going for diabetes.
So, doctor, also, how do the microorganism and enter the food? If you can also please explain that.
That's a very good question. Now you walk. Then once you're walking, what happens is some conflicts or some nail pricks. Then there is a foreign body. There's a foreign body which goes into the body, and then these organisms slowly keep on multiplying. Everywhere there is Clostridium, we call it organism. If you get a
Mhm.
hit by a iron rod, you go and take it tetanus toxin. So this will be the focus of infection. Outside there'll be cow dung, there'll be mud and everything. That
Mhm.
enters to the skin and the subcutaneous tissue. And there, if the diabetes is there, the organism keeps on growing. You and me
Mhm.
are not diabetic. It does not grow. The organism does not. That is the pool for the organism to bigger in size. And that the patient is ignorant of that. He will be thinking this is nothing, and because there is no pain, so he'll think that nothing to do, keeps on walking. That is where the organism grows bigger and bigger size. There is no vascularity. So it is a dead tissue where it keeps on growing, forms an ulcer, forms pus, breaks up into an ulcer, and then there you land up to a diabetic foot infection.
Can diabetic foot be cured? I mean, we also have some images that you actually have sent us. So we'll be showing those images, few images over here that, how you treat the diabetic foot and how you have treated at your hospital the diabetic foot. So I would like to show those pictures to our audiences, the before and after pictures. So now I actually would like to ask you that can it be completely cured?
100%. This
Okay.
is a disease which can be cured. Now we are running a logo saying that I prevent amputation, IPA. We prevent amputation. So now people should know that amputation can be prevented if they report to the hospital at the earliest. The more
Okay.
you do, the more ignorant you are, the more you take the sugar, the more you are not going to the doctor, you'll have problems. Diabetes is a lifelong disease. You start taking the
Yeah.
treatment, the disease is cured. Stop taking the treatment, the disease progresses. So it is a curable disease and it can be prevented if you report to the hospital, number one, and if you treat the disease. So it is not an incurable disease, definitely.
Mhm.
Even for the ulcer which I've shown, that is the most important cause for ignorance.
Mhm.
SCubeTV is doing a very good job by sending these messages to people that diabetes is a curable disease. Identify the earliest, control your diabetic ulcer, control your diabetes, then it's definitely a curable disease. It's not going to create problems unless and until you land up into complications.
You actually have actually mentioned that before that the person who is obese or who is having obesity might be at the risk of developing diabetic foot if he's having diabetes already. But apart from obesity, are there also some other kind of people who are having diabetes and who are at the risk factor of developing diabetic foot?
Whenever the patient comes to you with a cardiovascular disease, complications are so much that you will not be able to treat the complication. So cardiovascular system is one of the most important complications where the patients will die in case of a diabetes. That is the first and foremost complication. Then add a disease like cancer and diabetes, then the prognosis is good. Then kidney disease and diabetes, again the prognosis is very, very bad because this both go together. Cardiovascular, the renal system, and the vascular system. You have some vascular problem, again the disease is more common. So you have to control all this, then the diabetes will be.
I would like to ask from you one more question that how can one prevent from happening a diabetic foot or diabetic foot ulcer?
Diabetic foot ulcer is first and foremost the diet. I don't tell you not to take sugar. Take the sugar in the regular time. Do plenty of exercise, walking every day, morning and evening, definitely will prevent because that opens the capillary and that opens the vessel. Regular exercise and then diet is the most important factor. Take your
Mhm.
tablets, whether you are in an oral hypoglycemic or injection, take
Mhm.
that properly. That is the most important factor which they ignore sometimes. Regular diabetic test, fasting blood sugar, post lunch blood sugar, which will control. And then keep your food clean. And then whenever you have an ulcer, immediately report to the hospital. Treat it whenever it starts as a small ulcer. Definitely, you're prone for infection. You cure the ulcer, it will not. And then, of course, drink plenty of oral fluids. That is the most important. You'll be able to pass urine, and your kidney will be keep on flushing. And the treatment is very, very important. If you are oral tablets, continue oral tablets. If you are injection insulin, continue injection insulin. Daily or alternate day, check your sugar, check your blood sugar, or check your urine sugar. Then you'll come to.
Are there any myths related to diabetic foot ulcer that you would like to burst right now, or you would like to tell, to the audiences that they should be aware of?
The most important thing is footwear. Wear a very, very good footwear which is comfortable to your foot, not it is very, very tight. Stockings, it should not be tight. See that the vascularity is maintained. And then do your leg exercise, which is of very, very important. Walking, jogging, running is the most important thing. Do flexion and extension exercise. And then get your regular checkup. And whenever you have a doubt, whenever you have a swelling, see a doctor, consult a doctor, whether you are developing a cellulitis, which may go into a complication. Sometimes what happens is just below the skin, there is a bone. So the bone gets infected and then patient will develop osteomyelitis. That will be the most important factor whenever you see. Always see that you do a regular exercise. My father was suffering from diabetes, but he did not die of diabetes, but he died of some other disease. Do regular exercise daily to control the diabetes.
Thank you so much, Dr. Syed, for again coming to SCubeTV and speaking with us on such an important topic and actually enlightening the audiences on such an important topic. So I'm sure they must have gained a lot of knowledge and they must have got a lot of information about diabetic foot ulcer. So thank you once again.
Thank you. Finally, I say I prevent amputation. Thank you, SCubeTV. And thank you, Rajni, for this.
It's a pleasure always. All right, guys, that's it from SCubeTV Global. Keep on watching and don't forget to subscribe to the channel.